Okay, so before I would go into the patient's room, I would check the electronic health record, and then I would also check any labs or any orders for the patient. And then I would check to make sure there's anything on the door, like special precautions or anything. So I have universal precautions so I can go in. So, hi, my name's Brittni and I'm going to be your nurse today. And I'm just going to check your name and date of birth.
Okay.
Can you say it for me?
Edenville, 1298.
Perfect. And then I would wash my hands, make sure the door is closed. And then I would just say, like, what happened to you? Why are you in the hospital?
I was riding my horse and I fell off, and then my head really hurts right now.
Oh no, where does it hurt at?
Like more of the front side.
Okay, right here?
Yeah.
When did this happen?
Like yesterday.
Yesterday?
Mm-hmm.
Okay. So how severe is your pain on a scale from 0 to 10? 0 being no pain and 10 being the worst you've ever felt?
I would say it's at a 5 right now.
A 5? Okay.
Yeah.
So it's doing better since you had it?
Mm-hmm.
Okay, good.
Yeah, doing better today since yesterday. So.
Okay. So then I would see that her facial expression is relaxed, and I would also say that her body position is relaxed and she's pretty calm. And I would check her level of consciousness, which she's alert because she is talking to me. She's making sense, no like articulation problems or anything like that. She's hearing me well. She answered my questions fine. Her skin is pink and it looks good. And yeah, I think that's good for her general appearance. Then I would make sure to check her vital signs. So I would do her temperature here. If I can get it out. Hands are sweaty. You can't get it out. There we go. Okay. Make sure that's good. And then I would just make sure I pull the pinna up and back and check. Okay, and 98.4, so that would be good. Okay, and then next I would do her, I can do her apical pulse. So, and also I would probably do my respirations at this time too, but I wouldn't want to tell the patient that because usually it could like alter their respirations. So I would just have you lift your shirt up there. Perfect. Okay, so her respirations were at a 14 and her apical pulse was at a 65, so that's pretty good. And then next I would check pulse oximetry. So I'd have a pulse oximeter and I would put it on her finger and I would check how much oxygen is in her blood. And usually that's from like a 96 to 100 is good for that. Then I would do her blood pressure. So I would get my blood pressure cuff out. Oh, perfect, thank you. They must have left it in your bed when they came in here. Okay. I'm gonna wrap this around and make sure it's okay. Does that feel alright?
Yep.
Okay, good. And then I would first estimate her blood pressure. So, whoops. There we go, I'd make sure that's. So I would find her brachial pulse. Okay. Do you know what your normal blood pressure is usually at?
Like 117 over 80.
117 over 80, okay. Ooh, there we go, okay. I just make sure this is working. Nope. Okay. There we go. that like? So it was about 100, so I'd make sure to pump it up to like about 20 more, so I'd pump it up to about 120. Or 125-ish. Okay. So that was like 118 over 76. So that's pretty good. There we go. Okay, then next I would go on to the neuro. So for neuro, I would check the coma scale. So I would check that her eyes are spontaneously opening and closing. I would check her motor response, so if you could move your arms and your legs. There you go, perfect. And then I would check her verbal, which I kind of already did because it's good with that. And then she already took her glasses off for me, which was super nice. So I'm just gonna check your pupil size. So let's look at that. And since she has a concussion, it's going to be, her pupil size will be a little more dilated, so probably about like a 7. I would say, when it's supposed to be about 4 to a 6. So they're just a little bit more dilated. And then I would check these. Perfect. So they're still a little more dilated, but they do constrict some. So then next I would check her muscle strength. So I'm just going to have you push up on my arm. There you go. Push down. Good. Okay, I'm going to have you do pedal. Perfect. And can you lift your leg up? Can you push down? Good. Can you push up? Good. So her strength is good. So then I would check like if she has any facial drooping or anything like that, which it looks good. And then I would also check her ability to swallow. So are you swallowing okay? Everything good? Okay. You had some drinks of water earlier?
Mm-hmm.
Okay. So then her swallowing is pretty good. Then I would check the sensation of her fingers and toes. So she can move them. Good. That is good. And her arms and legs, I saw she moved earlier, so she's good with that. Next, I would do her respiratory. So I would check if she's labored breathing or if she's unlabored. Have you had any problems breathing? No? Okay. So then I would do her, also if she had an O2 mask or anything, I would check that to check like the rate of it, the flow of the rate. Next, I'll auscultate. So I'm going to have you just sit up to the end of the bed actually for me, if you can. Yep. Are you dizzy like that or anything?
Nope.
Oh, you're good. Okay. Yeah. So then I'm just going to listen. And I usually would have them like pull up their shirt, but it's okay for right now. So I wouldn't do it over clothing, but okay. So then I'd listen. Could you take some deep breaths for me? Good. Good. Oh, here, I'll go this side. I'll do the laterals. Good. Okay, and all those sound pretty clear. So then I'd come to the back. I would make sure I check all the lobes of the lungs. So, deep breath. Good. Okay, and they all sound really good. So I would also check to make sure if there's any like adventitious sounds, any other weird noises. Then I'll also check, have you been coughing a lot, anything?
Nope.
Okay, have you spit up any mucus? Have you had any mucus problems?
No mucus.
Okay, good.
Like
if you cough up any mucus, just let me know, like what color it is or anything like that. I'd like to know. And since you've been laying in bed kind of for a while, make sure you take deep breaths so that we don't want to catch pneumonia or anything. That would be more for a post-op patient who had like anesthesia or something. We wouldn't want secretions to build in the lungs, but just deep breaths are always good when you're laying around and stuff. So next I would check the cardiac, so your heart. So I'll just have you stay sitting up for me. And I would make sure to check all the 5 points. So I'm just going to... Okay, and I would usually hear S2 better towards the top, and I'd usually hear S1 better more towards the bottom. And I would also check with the diaphragm and the bell, so I would go back and I would check again. But for time purposes, I won't right now. But so it all sounded good. There weren't any murmurs or anything like that. And then she had a regular rhythm, and everything was fine with that. So I'll just have you lay back down for me. I'm just going to check your capillary refills. So I'll just push on your finger. Good. And it's less than 2 seconds, 2 to 3 seconds. And then I would do your toes too. Okay, I'll take that. There you go. And then, good. Good. Okay. Do you want that back on? Okay, good. And that's all for that. And then I would check her any edema. So I would just pull up here and check for like tibial edema, and I could just look, and I can't really see any edema, so she's good there. Then I would check, and they're good bilaterally, and then I would check her radial pulses. So actually, I'll do both of them right away. She has strong 2+ radial pulses, and also her tibial 2+, which is good, and her dorsalis pubis, which are good there. So then those would both be 2+. And then I would also check if she had an IV. I would check the IV site and make sure that it's not infected or anything. I would check the rate of the IV that is flowing at and make sure that's good. I would check to make sure her skin integrity is good also. So from the looks of it, everything looks good. I don't see any lesions, no breakdown of skin or anything from laying around. I'd also check her temperature bilaterally. So as I feel it's warm to the touch, which is really good. No skin breakdown. I would maybe use a skin or breakdown scale for like a Braden scale at a hospital I would use, if that's hospital policy. I would also check how like the bed is, so if it's comfortable for her and if there's any extra padding or anything special like that. And then next I'll go on to the abdomen. So I'm just going to have you lay flat for me. Good. And could you pull up your shirt? Perfect. So I would check the contour of it so it looks flat. And then I would check all 4 quadrants for any bowel sounds or anything like that. And I would start down the right because that's where the most active bowel sounds are heard. So. And I heard vowel sounds in all 4, which is really good. Then I would also ask you about like stool and things like that. So how often have you had bowel movements?
Like once a day. I'd say.
Once a day is good. Okay, what's the consistency of them? Are they like formed, loose, anything?
It's pretty formed.
Pretty formed, okay. Color, is it?
It's brown.
Brown, good.
Yeah.
Good, that's normal. So I've just checked that. And then I would also check if she's been having any nausea or anything or vomiting. Have you been sick to your stomach at all?
Nope.
Nope, not since when you fell off the horse, did you any at all?
Not first, but now I'm like.
Now it's better?
Yeah.
Okay, good. And then I would also check any tube draining, like if she had any like a chest tube or anything in her abdomen, I would check that too. And then I would check her urine, like how often she's going. So how often have you been urinating?
Probably like 3 to 5 times a day.
Okay, that's good. Do you go about like a decent amount every time?
Mm-hmm.
Okay. What's the color of it?
Yellow and clear.
Clear? Okay,
Yeah.
not cloudy or anything?
Nope.
No burning, itching, or anything like that?
Nope.
Okay, good. And then I would also check if her bladder was full, if she wasn't urinating often or anything, I would check to make sure that, like with a bladder scan, I would probably check to make sure everything is okay with that. And also, I would check if she had orders for TEDs, I would check that and make sure she's wearing her TEDs often so that she could get blood flowing. And also I would check the position of the bed. Are you comfortable? Everything's good. Make sure she's not like sitting at an awkward position to make sure no skin breakdown or shearing is going on or friction. Have you been up and walking to the bathroom lately?
Yeah.
Okay, good. And have you felt dizzy at all? Lightheaded?
No, not really.
No? Okay. Have you gotten assistance when you walked?
At first, but now I'm kind of
Okay.
so.
Okay. You haven't had to use like a walk or anything to help with your stability?
Nope.
Okay,
No.
so that's good. So you'd always just make sure like if someone had crutches or anything that they'd be using those when they get up and walk. And also if they need assistance, I would have them call for someone to help them to the bathroom. And also at the hospital I would do like a risk for fall scale. I'd maybe try to find one of those just to make sure she's safe when she gets up and starts ambulating. And I think that's all I have. I would just make sure that the bed is back to the lowest position. You have your call light, so there's your call light for you. And I would wash my hands and just let me know if you need anything. Thank you for everything.
Thank you.
You did well. And
Best nurse I've ever had.
Oh, thank you so much. Let me know if you need anything.
Okay.